if you've had your wisdom teeth extracted and you heard about potentially not being able to feel a little bit of your lip on one side or kind of like the chin in this area. Hi, this is Dr. Daniel Choi with North Texas Dental Surgery, and just wanted to go over a common question that patients have about potential nerve damage, right? So you've heard of nerve damage from getting your wisdom teeth extracted. And so what are we exactly talking about? So if you've had your wisdom teeth extracted and you heard about potentially not being able to feel a little bit of your lip on one side or kind of like the chin in this area, what that usually happens, the reason why that typically might happen after a wisdom tooth extraction is that they might have somehow interfered with the inferior alveolar nerve. Okay, so the inferior alveolar nerve is a nerve that lies on each side of your jaw, and it actually innervates your teeth and the soft tissue around the lip on each side of your jaw. So again, you have two sides to the inferior alveolar nerve, and they both innervate each side of your mouth, right? So sometimes I have seen patients who had their wisdom teeth extracted. I've heard stories, patients, and actually my fiance, she had her wisdom teeth extracted when she was 29 years old up in Toronto. And she said for about 6 months that she was pretty numb on one side specifically, after getting her wisdom teeth taken out. And so again, this inferior alveolar nerve is a sensory nerve. Okay, so it provides the feeling of the sensation of feel. It's not a motor nerve. It doesn't control your lip or make things move. It just provides the feeling of sensation, the sensation of feeling. So that's basically a major nerve that we're really looking out for whenever we're doing wisdom teeth extractions. But this traditional panoramic x-ray is helpful for us when we bring in a patient for a consultation. Before we remove their wisdom teeth, we're kind of looking at, all right, what potential risk factors do we have of potentially hitting the inferior alveolar nerve? So we want to stay far away from that. Well, the most useful piece of information that we have is using this 3D technology to basically have that added dimension of depth to really show us where this inferior alveolar nerve lies and how we can specifically plan our surgery around this. So again, whenever you're getting your wisdom teeth extracted, you definitely want to find a provider who has this 3D technology, because it really allows us, versus the other traditional 2D panoramic x-ray that 90% of dental offices have, you want to make sure that you have this 3D technology, which gives that added dimension of depth. Because when we have that added dimension of depth, we can really see where on this sagittal view, we can see the inferior alveolar nerve and see where our tooth is in relationship to that to avoid any potential damage. Few stories that I've heard, again, for example, my fiance couldn't really feel one side of her lip after her wisdom teeth extractions. Now, the beautiful news about this is that usually if there is any inferior alveolar nerve damage, typically it goes away over time. So that's the good news, right? Not in every case, but the good news is that basically in every patient that I've seen, they had their wisdom teeth extracted at other offices or years ago, or they tell me their stories, usually that feeling of sensation comes back. However, I have also seen patients, for example, there was a nurse that I saw probably in about her mid-30s, and the reason I saw her was that she came and brought her daughter to me for her wisdom teeth extractions. But the mother told me a story where she, within the last year, had her wisdom teeth extracted due to pain on one wisdom tooth. She spoke to the oral surgeon and he recommended that she remove all 4 of them. And so she did, but the problem afterwards is that the side that she wasn't even hurting on originally, she ended up getting some of this nerve damage from, again, this inferior alveolar nerve. So something had happened during that surgical procedure where the patient was feeling numbness in her lip and chin area, and it was disturbing for her. And so one of the things that she was telling me is that when she was applying her makeup, she couldn't feel when she was applying the makeup to that area, again, because the inferior alveolar nerve is a sensory nerve, right? So her having had gone through that experience, and I asked her, hey, did that surgeon use this 3D technology? And I showed her the traditional 2D x-ray, and she said, yeah, this is the only thing I remember ever seeing. He never expressed to me anything like this technology where we can actually go through and see basically what's going on and where basically the risk factors lie before proceeding with surgery. So, again, she was a little upset that, she had that experience, and that's why she sought out a different surgeon to get her wisdom teeth extracted with, and that's how I ended up seeing her daughter. So again, like if you, when planning your wisdom teeth extractions, or you already had your wisdom teeth extractions and you're feeling this sensation of numbness, there's a good chance that there was something that happened with this inferior alveolar nerve. Now, one other thing I do also want to mention is that just by dumb luck, sometimes when we numb a patient up to remove your wisdom teeth, we can approach this inferior alveolar nerve area where we're numbing a patient up. And that's why this patient can also experience similar symptoms of numbness in their chin lip area. So not necessarily that anything was done wrong when removing the wisdom teeth, but just by dumb luck, when we're numbing a patient up and because that needle and the anesthetic approaches too closely to the nerve, you can experience some paresthesia in your lip too. So again, this is a very, very, very minute percentage of cases, maybe like, good Lord, maybe less than 0.1%, but there also is a possibility, and that's why a patient might experience why you're numb in the lip.